Hi, my name is Jigar. I'm a patient caregiver for Paresha. I'm his son, and he's been diagnosed with lung cancer since 2018, and we have been taking care as a family. Our first reaction as a family, actually, we didn't knew about cancer. He himself took care of it by doing PET CT and CT scan, MRI by himself. He was in China at that time, and I was in United States. I do remember that it was 2nd of April when his report came in, and he told my grandparents, my mom, that he got diagnosed with lung cancer and it's in stage 3B. After that, he called me and told me about his situation. I was in United States at that time, and one fine morning he just calls me that he's been diagnosed with stage 3B lung cancer. And my first reaction was he's kidding, because it was 2nd of April and I was thinking he's making April Fool. So I didn't really believe him, and I was just questioning him what he came to know, what's the reason why he's telling me that. It was just I was not in my right mind to understand what he's saying, and I was in sheer shock. So as he was in China when he got diagnosed, his very first decision was to move back to India, because being in China and getting treatment, it would be a little difficult, and language is the biggest barrier. Secondly, I was in United States at that time, and we were still deciding whether I should stay in United States, or my decision was to come back. However, considering the financial cost that it can come with cancer, and I got confidence from my sister as well as from my mother that they would be taking care of him, and my need will be more on the financial side. Plus, my sister was doing MBBS, that's bachelor's in medicines at that time, so that was an additional cost as well as we didn't know if his job will continue after getting cancer. So being a family, we decided my more role would be to stay in United States and give financial support, and my family will take care of him over here with all the needs of the hospitals and clinics. Our daily routine was initially when he got his chemos and radiation. I knew it was very hard. I can see that he was struggling, having to eat the food. Even there was an instance when he lost his consciousness and almost got a crack in his ring finger, and those were the times that I felt like I should have been over there and be his support with him. But at the same time, the cost of chemos, radiations, those were something that were always like a thing that if I come back to India and stay with him, what would happen to my job? How we are going to pay for it? How is that going to impact? And considering that it had a bigger impact, I still decided to be in United States, and his radiation lasted for almost 30 days, and he was still not recovering the way it should, but we were always trying to give him the positive attitude. We are always trying to stay positive with him, and whenever we'll talk, we will I know he was going through his own mental challenges, but as a family we were trying to see the good things about, that you got the cancer. If you keep the positive attitude, this is gonna help you a lot, and it's gonna be all right. We moved from normal chemotherapy to immunotherapy. From immunotherapy, we tried to know. We did contact the doctors in United States as well. When he came to United States, we had a second opinion, and that gave us an assurance as well. The treatment that he is getting in India is very high class, and some of the meds were not even qualified to be used by the patients in United States, but because we were getting it over here, it was very good for him. few years down the line, 2020, he got his NGS, next generation sequencing done, and we came to know about his ALK positive mutation. After that, we know that there were a lot of meds and there was a lot of research going on, and he decided to go on serotinib at that time. Life became a little more easier after that. I got married, and we hosted our like my parents and my grandparents in United States. They stayed with us for almost 4 months at that time. We had a lot of travel plans, so we did cover almost 6 to 7 states within the United States, and yeah, the life has been good after being on targeted therapy. So there were times that we as a family would be talking about his situation, how cancer has affected him, how his behavior changes sometimes, how he becomes more impulsive. But we did decide that we as a family need to be very conscious when he is getting impulsive and not react to that, rather than be more positive and just let that phase pass. We are also talking about his day-to-day schedule, and I know my father's willpower is great, and when he decides on something, he goes behind that blindly and just follows it till he gets the result. So we just had to give him that motivation just to continue with what he does, and he would be good. So that was a big factor as a family, that we decided that what we have to, or how to behave, how to act around him. Also, because of as he get to know about the Lung Connect group, and when he joined, we were little obnoxious that how it will affect him, because I know I have seen patients, and maybe that can result into negative impact. But after connecting, the way his behavior has changed, because he saw what patients are going through, and he was able to share his story. That made us feel very proud, and that gave him a motivation by himself that he has something to fight for. And also because of Lung Connect, many patients are calling my father, and he's able to consult them and talk to them regarding his story. I have seen that myself, how that motivates him, and as well as how the patient's perspective regarding the cancer changes, and that gives him, whether it's the patient himself or the family member, that gives them a positive mindset as well, and that really makes a lot of difference.